Thy Superscript O Thy Sedilla USA Pharma Guide, Prescription Medicines and Key Therapeutic Areas 1 I Diaresis Sedilla AF Pound Cardiovascular Medicines, Key Classes, Antihypertensives, for example ACE inhibitors like lisinopril, ARBs like losartan, beta blockers like metoprolol, statins, for example atorvastatin, rosuvastatin, antithrombotics, for example clopidogrel, warfarin, novel oral anticoagulants like apixaban, heart failure treatments, for example sacubitril, valsartan, SGLT2 inhibitors now indicated in heart failure. Increasing use of SGLT2 inhibitors and GLP-1 receptor agonists, initially for diabetes, in heart failure. Focus on personalized risk management and combination therapies. 2 I Diaresis Sedilla AF Pound Diabetes Medicines. Key Classes, Insulins, for example insulin glargine, insulin lispro, metformin, first-line oral agent, SGLT2 inhibitors, for example empagliflozin, dapagliflozin, GLP-1 receptor agonists, for example semaglutide, liraglutide, DPP-4 inhibitors, for example sitagliptin. Emphasis on cardiovascular risk reduction in type 2 diabetes. Shift from older sulfonylureas toward SGLT2 and GLP-1 therapies. 3 I Diaresis Sedilla AF Pound Oncology Medicines. Key Classes, Chemotherapies, for example paclitaxel, doxorubicin. Targeted therapies, for example tyrosine kinase inhibitors like imatinib. Monoclonal antibodies, for example pembrolizumab, nivolumab. Immunotherapies, for example CAR-T therapies like T-Sag and Laclucel. Personalized medicine with biomarker-driven therapies. Accelerated approval pathways for breakthrough therapies. Emphasis on patient assistance programs due to high costs. 4 I Diaresis Sedilla AF Pound Central Nervous System, CNS, Medicines. Key Classes, Antidepressants, for example SSRIs like sertraline, SNRIs like venlafaxine. Antipsychotics, for example aripiprazole, olanzapine. Anti-epileptics, for example levetiracetam, lamotrigine. Multiple sclerosis therapies, for example fingolimod, ocrelizumab. Pain management, for example opioids with tight regulations, gabapentin. Focus on balancing efficacy with safety, especially with opioid medications. Newer agents for treatment-resistant depression, for example histamine nasal spray. Emerging therapies in Alzheimer's, for example lecanemab, with ongoing debates on cost and effectiveness.